Andy, top that.
Top that,
It's
Andy.
going to be hard to do.
Top it.
Next we have Andy
There's some
Flemmer,
folks
who
that-
is the new CEO of AVRMC. Wow.
Thank you. So hard to believe I started unofficially June 20th and officially on July 1st after Lynn retired on the 30th. So just a little bit about Mike, and appreciate the invitation from the mayor to come meet the council and start getting to know you all and working with you all. And yes, I'm from the South. I grew up in Virginia, so that's where the y'all's coming from. So my wife's from Texas, so she's got y'all and she's fixing to do stuff all the time.
So does Sky.
So hard to believe I've been a healthcare executive for 38 years. Started as a evening and night administrator at a 740-bed level 1 trauma center, academic teaching medical center in Roanoke, Virginia, which is in the southwestern part of the state. From there, I went to grad school at Trinity University in San Antonio, Texas. Got my master's in healthcare administration. That's where my wife and I met. We helped each other find our name tags at orientation. And did all our projects together, and she helped me get through grad school. I better put that out there on the record, or she'll correct me later. So just some of the additional experience, I've worked in small rural community hospitals, large urban hospitals, and everything in between. Carillion Health System, which I started with in Roanoke, Virginia. The 740-bed was the flagship, but most of the hospitals in that 11 hospital system at the time were small, rural, critical access hospitals, and I served as the interim administrator for many of those hospitals from the time I was a resident when I came back from grad school to do my third year of my master's program, and all the way through the time I served as an assistant vice president there. And so they like to give their administrators and their families a long sabbatical to go recharge their batteries, and I would go in and help fill in at that hospital. That was great training for me.
Great training.
After that, I went to work for a for-profit large company. Some of you may have heard of HCA, Hospital Corporation of America. Went from southwestern Virginia to heart of Los Angeles and west San Fernando Valley. Talk about a culture shock. And so I grew up in McLean, Virginia, which is a suburb of Washington, D.C., directly across the river from Washington, D.C. And so I wasn't unfamiliar with large cities, but Los Angeles was an eye-opener, and especially in the early 90s. So I served as an assistant executive director at a 400-bed hospital, and then they promoted me to be the chief operating officer of their hospital in College Station, Texas, which had just been newly built. And after that, they promoted me 2 years later to the COO of their hospital in San Francisco and to become the CEO of that hospital. I made a career change and went into medical group management and joined San Jose Medical Group as their COO. And that's a 300 physician group in the San Jose metropolitan area. Then I was recruited away to be the CEO of San Francisco Medical Group in downtown San Francisco. That's where our daughter was born at California Pacific Medical Center. So my wife and I have a 26-year-old daughter, and we've been married for 30 years this September. And so I've most recently served as an interim executive for Centura Health, based in Denver. They're a faith-based Catholic health system. They're part of Common Spirit Health, which is a big national health system, not-for-profit, and they have a number of rural critical access hospitals that they either own or they manage. It started in Durango at Mercy Hospital in Colorado in March of 2020, and everybody probably remembers what happened in March of 2020, COVID. And so I was immediately made the incident commander as soon as I walked in the door. And then I went from there to Garden City, Kansas, to be the interim president and CEO of St. Catherine Hospital and Bob Wilson Memorial Hospital. St. Catherine's a 102-bed hospital, and Bob Wilson is a community demonstration project hospital similar to critical access. It's 26 beds, not 25. That's the distinction. And so was there from August of 2020 through January of 2021. And then Centura asked me to go serve as their interim CEO at Goodland, Kansas and Atwood, Kansas, 2 critical access hospitals. I was there from January through at the end of June. And the former CEO at Prowers Medical Center, Craig Lovelace, followed me as their CEO. And so it's a small world. So my career has been in this region for the last few years. And so backing up a little bit, one of my classmates at Trinity, Lori Breedlove, is the Senior Vice President of Human Resources for Community Hospital Corporation. She knew what I was looking for in a next career move. I was getting weary of the interim roles and the gaps in between assignments, and just some of the challenges were pretty daunting at many of these interim assignments. But I was able to get 5 hospitals through COVID during my tenure. And so I helped them come out better financially than when we started. But I was looking for a full-time position as a CEO in an independent hospital in a community that's smaller but not isolated. And my friend Lori called me up and said, I think I found what you've been telling me you're looking for. And it's in La Junta, Colorado. And I knew where La Junta is because I drove through here going to Garden City. I came through here when I was an Eagle Scout with my Boy Scout troop from Virginia, going to Philmont, and stayed at the Cacheri Indian Kiva. I said, this all looks very familiar. So again, small world. And so my wife and I are excited to be here. We moved into Casa del Sol, the new 2-car garage duplexes, and they're actually way nicer than our two-bed house down in Sun City Grand. That house is 25 years old. This one's just a few months old. They did a really nice job. They are spacious, modern, very well appointed, and some nice amenities. A nice housing option here in La Junta.
The mayor serves on that board.
He mentioned that to me. Y'all did a nice job. That was one thing I was concerned about. My wife's initial feedback when I asked her if she'd consider moving here. She immediately got on Realtor.com and didn't see a whole lot that was real appealing. So Dale Leidy, our board chair, learned of an opening and put the deposit down and signed the lease on my behalf. Secured housing for us. So appreciate that, and that's just more of the welcoming that we've seen from the community. The mayor and I had a great meeting a few weeks ago that Elaine helped put together, and then we toured the hospital. The tour, Joe, was supposed to last maybe 30 minutes. I think we were in the tour for, 2 hours?
At least, yeah.
We toured every floor, every department, and I think Joe either knew everybody in the hospital or they knew him. So I thought that was a really good sign. And so the board gave me some priorities. And one was to focus on the revenue cycle. And for those of you all that don't know what revenue cycle means in healthcare, it's not the billing department. Don't blame the billing department if you're having problems with getting your claims paid. That's just a piece of it. It starts with the providers writing orders and documenting in the chart and documenting the way the insurance companies will pay for something. So the second is getting prior authorizations when you need them and knowing what the rules are so you can get a claim paid. Another part is scheduling properly, and then registering the patient accurately with the right demographic information, the right insurance information. And then you have the actual care that gets delivered. Then you've got to charge for it properly. And then you've got to close that account and get a clean claim out the door. And the hospital's been struggling with that for many years. And it definitely is impacting the financial monthly net income for the hospital. But I'm glad to tell you, fortunately I have some revenue cycle background, and we already have an action plan and already have implemented it. So I've done an assessment working with my interim CFO, who is awesome, by the way, Joe Jeans. He replaced Judy McLean, who was here from February through July. And Judy was doing two jobs. She was the Vice President of Finance and Accounting for CHC, the entire corporation, and our interim CFO. That was a hard job to do too. So they placed Joe here in July, shortly after I started, and he and I were working extremely well together. And to be able to complete an assessment of an entire revenue cycle in a hospital, which is very complex, and get an action plan developed and implemented, and have a team assembled. And we meet weekly, and we're already starting to see some incremental improvement in our performance. So glad to be able to inform you all of that. It's going to take a while, though. People are still going to see claim bills that are coming late to their home address. They're going to see the late filing of claims with their insurance. They're going to wonder if we billed the claim to their insurance. As we sort through all these details and the different layers that I described to you, we will get this improved. And I'm personally attending these weekly revenue cycle meetings. Joe leads them, but I'm giving them the support they need and the guidance, because I've done this before. Then also I have some great news. It's kind of bittersweet. Gloria Thomas is going to retire. I know everybody can't believe that. She's been here 40 years in the same position at Arkansas Valley Regional Medical Center.
She will be missed.
She will definitely be missed. She is a class act. One of the best executive assistants I have ever worked with.
Rick, her husband, will like that.
And she extended her retirement by almost a year. I don't know if everybody realizes that. To wait for the new CEO to come in and transition and help make sure. That's just the type of person she is, and how she sacrificed to be here almost a year longer than planned, because it just took longer to get the position filled.
Thank you, Gloria.
And so I'm pleased to announce that Karen Martinez, our current medical staff office coordinator, who's been at the hospital for 10 years, and most of that is our medical staff coordinator, and a very similar job to supporting the medical staff to supporting the CEO and the board. Karen has a stellar reputation here in the community as well as at the hospital, and so she will be she's already started and covered a week of PTO for Gloria, but at least I could do was give Gloria a week off. And so Karen covered that first week, and then Karen started training and going through the transition process. We have not set a date for Gloria's retirement yet. She hasn't set a date. She wants to make sure everything's in place. She has created a binder of all the processes that we go through in a hospital during a year cycle, 2-year cycle, 3-year, and a quarter. So it's that's a lot of additional dedication to the community. So I'm glad to be able to promote from within and recognize another stellar contributor to the hospital that serves this community. I've also formed my senior leadership team, so that is my inner circle of leadership, and so my interim CFO, Joe Jeans, our CNO, Heidi Gearhart, who's been at the medical center for 17 years, and a very strong CNO, and Kelsey Herman, our human resources director, and Travis Bender, who's our director of quality, patient safety, and patient experience. He's got the longest title. He needs a longer badge. And so that we meet weekly. We just started meeting last week. I wanted to pull that team together and start focusing on building our strategic plan and refreshing it. So CHC provides us with consulting services, and one of those is a market assessment. And so I've kicked that off. That's the first step in strategic planning. It's a SWOT analysis on steroids, and that should be completed in the next month or two, and then we will get the strategic plan presented to the hospital board and potentially here to the city council as well. And just want to make sure that we're staying in communication with the council and that we're working in partnership together also, I'm looking, part of that based on meeting with a lot of, every provider, physician and mid-level, so nurse practitioners and PAs. I've met with all of the providers and valley-wide, as well as the employed providers and some of the community and all the community providers. And I've also met with every one of the department heads, even if they don't report directly to me. And I've come to get a sense of what we need to focus on trying to either bring back to Junta and to the service area of Otero County, Bent County, Crawley County, and now Prowers County. We're getting a lot of patients from Prowers. And the common theme I've heard is we need more general surgeons, ophthalmologists, neurologists, pain management, wound care, and chemo infusion therapy. Those are not all going to start right away. It's going to take a while to build those programs, do the feasibility analysis, figure out how we're going to pay for them. But that is the feedback I'm getting from a consensus of talking with a lot of folks that know what they're talking about and what we need. So I'm excited to be here. So is my wife. My wife Shannon is a international medical transporter. She is a courier for an international nonprofit that picks up and delivers bone marrow and stem cells. So she's currently in Boise, picking up a donation, and will be bringing it to Toronto, Canada. And then she's got another trip to Buenos Aires coming up in a week or two, and then coming back up to Canada. So she enjoys doing that. She does about 3 to 4 trips a month, and she can fly out of Colorado Springs, no problem. So we're excited to be here. It is
Springs
nice.
is nice.
It is nice. Buffalo's worked for us too. We've flown out of there a few times. So any questions for me?
How many babies are we up to now, Andy?
For the month of August, we're over 200, I think, at this point. If you include what we know are pre-planned that we've been told about. So we're looking at I think we're looking at 34, 38 in September. But August never let up. We thought there was going to be a lull, and our physicians are working really hard, and so are nurses on our OB unit. It is very busy.
Very busy OB unit, yeah.
It is very busy, and they are taking care of some very sick moms and babies, and they're able to do it right here in Junta. And we'll keep trying to describe to the community what a wonderful medical center we have here, and it's not the buildings, it's the people inside. Their passion and their dedication and their expertise and their training are superb, and it's rewarding to see that every day when I make rounds. And I'm also trying to be out in the community as well, and be visible and be here with the council, and hope to do this on a more frequent basis. So thank you for inviting me here, and look forward to working with you all.
Anyone else have any questions for Andy?
I have a comment. I have taken it upon myself to question lots of people that I know work at the hospital, and without exception, I mean, there's been a bunch that I've asked. Everyone says that you are sociable, that you are approachable, that you are invested in the employees, that you are energetic, and everybody is singing your praises. Thank you for that. Certainly they're unappreciated, but it sounds like from the top on down, there's a good communication, and I applaud you for that.
Well, thank you. Thank you, Mr. Merlin.
Ditto. That's exactly what I'm hearing about you too. So thank you, Andy.
That's intentionally what I've been trying to do.
I had a question. Do you have any mental health help up there at the hospital? Or do you just send that southeast?
We really don't. That is a huge need. We have southeast behavioral health, but most of the primary care providers can provide some level of medical treatment, but it's pretty limited. So that, if I had to add to the list, it would be behavioral health here locally. You know, we do have some substance abuse clinics or clinic here, and I'd like to augment that at some point. So that is just one. That's a short list that I just listed off. There's definitely many more services that we really need to add back, because we truly are a regional medical center. We service 4 counties that I can count up, and probably a few others. We're getting patients from Springfield, as I used to go to Lamar, and so a lot of their OB patients are coming here, Springfield and Lamar.
Thank you.
All right, thank you all.
Thank you
Thanks,
also
Andy.
for reaffirming the expertise with the hospital staff,
It's
so
the-
that the public can hear that.
It's the people in the building that make the difference. Our buildings are old, but they're in good shape for the most part, and they're kept extremely clean. So,
Thank you for that.
thank you.
Thanks, Andy.
All right, you all have a nice evening. Thank you.
Thank you.